And to all our lovely souls, I'm supremely delighted to introduce our next speaker. She's extremely special, very, very vivacious, because I've been very fortunate enough to having met her. So I'm going to speak about our very amazing and gorgeous Dr. Sheila Dobee. Now, before I get into her professional outlook, I'm going to tell you something very interesting about Sheila Dobee. She's a master of all, and she's an ace at all the endeavors of hers. Now, that's a different story. Besides that, Dr. Sheila Dobee was invited to meet President Obama over a private dinner. And now that's pretty much interesting. And now coming to her professional profile, well, to all our lovely souls, please allow me to introduce Dr. Sheila Dobee. Was born in England and moved to the United States 20 years ago. She's a whole health dentist, a humanitarian, and an entrepreneur. She's also a television host. Dr. Dobee is the recipient of the Bay Area's Outstanding Woman of the Year Award and has been featured in numerous articles for her outstanding professional and social work. She's been the recipient of the California Patient Choice. Dr. Dobee takes a special interest in helping the underserved children and women in her local community. On the professional front, Dr. Dobee was the past president and dental health chair of Southern Alameda County Dental Society. She's a graduate of the American Dental Association Kellogg School of Management Institute for Diversity in Leadership. And her current passion is working with healcircle.org and kind #20. Look at her amazing smile, and with this lots of love, maybe please invite Dr. Sheila Dobee with a global namaste.
Namaste, Simran. What a lovely, beautiful thing to say. That was just so touching. Thank you so much.
Thank you so much, sweetheart. Thank you.
I just want to say I've been watching you on Facebook, and wow, you lead a very exciting life out there.
Thank you, Sheila. And we're extremely excited to hear from you, sweetheart.
So today I had to pick a topic which was about health and wellness. So it's all about dental health, which I know sometimes isn't the most exciting topic to pick. So I've tried to make it as informative and interesting as possible. So I tried to find a subject that was not so interesting and jazz it up for you guys. So here goes. Let me do my share screen. So the topic we're going to be talking about is the immune system. So the immune system is, you can hear it all around the news. Everyone's talking about immune system. And why is it important to have a strong immune system? It's really important to have a strong immune system because the immune system is what's going to keep us safe and healthy. So there are many systems in the body, like the digestive system, for example. When you're eating food, you eat the food gets digested, goes into the stomach, and then the stomach takes out all the good nutrients and then puts that back into our bloodstream. And then now we're able to kind of have a healthy system that's working well and giving us the right amount of nutrition. So the immune system is what's really important, especially around now during this COVID time and this pandemic, is because that's what's going to protect us and keep us healthy. So we have to make sure that every single person has a strong immune system. Now, the issue with the immune system is we have kind of limited help. Now, I'm going to give you an example of what the immune system, how it works. Think about this like you're a little town. So your body is this little town. And in this town, we have one fire department. So this fire department has maybe 10 good firefighters in there. And then in one part of your town or your village, there's a fire. So it's going to send a couple of the firefighters there to take out that fire. And then somewhere else in the village, there's another fire. So that fire team go there to fight that other area. Now, the issue happens is if there's multiple fires, then how's that fire department going to handle getting all the fire under control? So the issue then is we have to make sure we limit the amount of fires that are happening in our body so that our body isn't constantly having fires, so that it takes all our resources of our firefighting team. So how do we prevent that? Now, there's natural inflammation and infection that's going to happen in our body. It could be from an autoimmune condition that you have. There's kinds of foods that you eat that cause inflammation in your body. If you have some diseases such as cancer, for example. So those firefighters are going to be dealing with those resources. But for us as human beings, we have to make sure that our teeth are very, very healthy, because there is a lot of bacteria in our mouth. So one of the things that you probably didn't really realize is our mouth has 6 billion bacteria. And we have about 700 different species of bacteria. But the good news is a lot of them are great bacteria, which are really needed for our body. So there's good bacteria in our mouth and in our gut. But there's also a bunch of really bad bacteria. And if that bacteria gets into your body, it's very dangerous for you. So this is a little slide that I made and I worked on, and it basically talks about how the body is connected to the mouth, basically. So if we have an unhealthy amount of bacteria, for example, in the mouth where we have an overload, it can lead to issues such as Alzheimer's, dementia. The other thing that can happen is if you have bacteria in the mouth, that's unhealthy bacteria, it can actually go into the lungs and cause pneumonia and some other issues. The other thing that can happen is strokes and heart attacks because of the bacterial load getting into the bloodstream. There's reactions, more likely to get clotting. So therefore you can kind of see, and the point of this lecture really wasn't to stress you out and get you worried about something else, because before I go on and scare you, it's about just getting you healthier so that you can prevent all of these things, which can easily be done by simple things. So it's more just to bring to light that the oral health is really important. And there's a lot of people out there that have diabetes. And if you have gum disease or a lot of bacteria in your mouth, what's going to happen? It's going to cause the diabetes to not be fully under control. So that's a link that a lot of people didn't realize. So now I know a lot of people aren't able to go to the dentist, so they are worried about, hey, do they have healthy gums? Do they have unhealthy gums? So I'm just going to talk about what healthy gums look like. And we're also going to talk about a solution so that you don't be so worried if you do see something that you think, oh my gosh, I think I have that. So number one, healthy gums. So healthy gums look like this, nice and pink. There's no inflammation. Everything looks kind of firm. There's no smell in your mouth. Everything looks really good. And also healthy teeth also feel the same. Like you shouldn't have any toothaches. You shouldn't be having any like broken teeth or anything like that. Now, what does unhealthy gums look like? Now, unhealthy gums look this, as you can see with that black arrow. Unhealthy gums basically have puffiness. The gums look red, and we call this in the dental field gingivitis. But that's a word that you guys don't need to learn about that. Let it for us dentists. So gingivitis is that first stage of gum disease, and that's what the gums look like, kind of a little bit puffy and a little bit red. Now, sometimes the gums don't look like that, but you still have gingivitis. And how do you know that? Is if you're flossing or brushing and you look on your toothbrush and you can see that you have some blood or some just even like bleeding around certain areas of your mouth. So that's the first indicator that you might have some gum disease, a little bit of gingivitis. Now, don't worry, not everything that bleeds in your mouth could be gingivitis. Let's say you cut something when you were eating something, then that's not necessarily gingivitis. But gingivitis is very, very common. Studies have shown that 80% of the population has some kind of gingivitis somewhere. So it's very important that we take this seriously so that we know how to kind of treat it before it gets to the next level. Now, what is gingivitis as far as the treatment is brushing and flossing. So it's nice and simple. You got puffy gums, bleeding. All you have to do, get yourself a good toothbrush. I prefer electronic toothbrushes because they just work really hard and they're very fast. They go around and you just put a little bit of toothpaste on there, and then you can kind of go around all your teeth, and then you have good fresh breath, and also your teeth are nice and healthy and your gums are healthy. You have to be visiting the dentist regularly. Regularly is at least every 6 months, because that's when you're getting a lot of that bacteria that's going to be building up in your mouth. The other thing is making sure you're eating and drinking healthy foods. And I'm going to talk about that a little bit later. But it's the same thing that we all preach about health and wellness, eating the right foods, the right fruits and vegetables, but we'll talk about that in a second. Now, let's say we don't do anything about that gingivitis. So that gingivitis was basically the inflammation that was happening around the gums. What happens is the gums create a pocket because they're sort of bleeding and they get kind of puffy, and now they kind of open up a little bit, and then a pocket is created. When a pocket's created, then we have bigger problems, because what happens is bacteria now gets into that pocket and it gets worse and worse and worse. Now here is a diagram, and on the left you can see these kind of chunky pieces around the tooth. And what that is, that's the bacteria that starts eating away the bone structure. And then the next one, you can see that bone that holds the teeth actually gets less and less and less. And that's how some people, when they get older, they end up losing their teeth, because that gum disease has got underneath the gums, causing destruction of that bone area. And it's also causing bad breath. The other thing that you need to know about this level of gum disease is not everybody has the same signs and symptoms. It can be asymptomatic, where you think that everything's okay, but there's actually quite active and bad disease going on. That's why it's really important that you visit your dentist. For example, going to the dentist regularly is really important, because the dentist is actually going to look and check and make sure that you don't have active gum disease. How do we treat gum disease, just to let you know, is we actually go underneath the gums and we clean out all that bacteria that's under the gums. There are special antibacterial agents that we can use. I'm not a big fan of taking oral antibiotics because of other side effects. So sometimes, but we can put local antibiotics where we can go underneath the gums and just clean that out. And nowadays there's great technology such as laser. And laser is great because it goes in and disinfects the whole pockets and cleans up all the areas in the mouth. So if you do suspect you have gum disease, it's important to go to the dentist as soon as possible and make sure that that disease doesn't spread. Now, a recent CDC report showed that 47% of people had some kind of gum disease and periodontal disease at 30 years old. And that dramatically increased as people got above 65 years of age. It got up to the 70%. Another way that you can get bacteria in the mouth is by having cavities. And how do you get cavities? That's for another talk, because I know we don't have too much time here. But how you get cavities is basically you eating a lot of sugar and sweets, and then the bacteria eats that sugar, creates acid, and then you end up getting cavities. And that cavity, as the decays get bigger and bigger, can actually go into the jaw, can go into the bloodstream, and cause more issues, such as all of those issues that I mentioned. So it's really important, again, if you're noticing, I'm talking about sugar. Sugar is really, really bad, but we'll talk about that in a second. So how do we stay healthy? Now, staying healthy is there's the health of the body, which is kind of the eating and drinking, but a lot of that is also very helpful for oral health. So number one, we want to be brushing and flossing regularly. Now, why is that important? Because brushing gets rid of all the bacteria, the bad bacteria on the teeth. Flossing gets rid of the bacteria between the teeth. And let me give you a little tip about flossing. Flossing is something that a lot of people don't like doing, including me. So what I do is when I shower, I have a little cup and I put it on the side of my shower. And then I floss every day and I put it in that cup. And then once a week, I throw that cup out, and therefore it's gone. And the advantage of doing that is it's basically putting it into a system of something that you're doing every day anyway. So you're showering, so you might as well add flossing in there, because it's an easy routine to follow. Visiting your dentist at least every 6 months is very important because your dentist will check everything, including any oral cancer that's in your mouth, any broken teeth, any jaw issues, making sure that everything is healthy, no gum disease, and just also the dentist will look for other things like throat issues and tissue issues in your mouth. Now, limiting the amount of sugar. We're going to talk about sugar in a second. That is probably one of the most important things that we can do because sugar is very, very detrimental to the body. It's not only really bad for the brain, especially children. When children eat sugar, it's very, very detrimental for them because it actually damages a part of their brain. And studies are showing it can actually damage the part that leads to empathy. So a lot of these children will act up, they'll be hyperactive because they don't have that empathetic side of their brain working properly. The other thing that's important to know is there's a lot of hidden sugars that you don't know about. We'll talk about that in a second. Fruits and vegetables. Now, fruits and vegetables are great, especially foods that have a lot of fiber. These are a lot of the blueberries have antioxidants in there. Vegetables have all the right minerals that you need to stay healthy. For healthy teeth, you do need things like vitamin D, so making sure you're getting 15 minutes at least a day of natural sunlight. It's also important that you're getting the right amount of calcium through foods. And I really can't emphasize how important it is to be eating good quality foods, more of the organic foods and eating whole foods and not highly processed foods. The other thing that's very, very important is making sure you're getting adequate sleep. Adequate sleep is very, very important because people don't realize the importance of sleep. And sleep not only is important for things like memory consolidation, making sure that your memories are all intact, but sleep is also important for your immune system. If you don't get enough sleep and the right quality sleep, then you are very likely to have some kind of immune issue. So it's very important that you have a right amount of sleep. And I'll talk about that in a second too. And something that a lot of people don't realize is limiting the amount of mouthwash that you use. So a lot of people say to me, well, I thought mouthwash is good. It kills all the bacteria. But mouthwash actually kills healthy bacteria in your mouth too. Because it's killing healthy bacteria, the healthy bacteria aren't able to do the good things that they need to be doing. The other thing that's bad about a lot of mouthwashes have alcohol in them, and there is a link between alcohol and potential oral cancer. So you really don't want to be, if you're using mouthwash, you want a mouthwash that doesn't have any alcohol in there. So make sure you check the label. Sleep is needed for immunity, like I mentioned. So one thing that a lot of people have around the world is this thing called sleep apnea. I'm not going to talk about it here because of the essence of the time that I have. And I can if we do have a little bit more time at the end. But sleep apnea is very prevalent in the society. And that's basically people that are sleeping, but they're not able to breathe fully. So what happens is in the night, you actually stop breathing a few times an hour. And therefore, you don't get enough oxygen, and oxygen is really important for your body. And one of the key indicators of someone that has sleep apnea is someone that snores because they're not getting enough oxygen in there. Now, it doesn't mean if you're snoring that you have sleep apnea, but it is an indicator that you could have sleep apnea. And sleep apnea, and if you have a thick tongue, because a thick tongue and a thick throat also, because what happens is there's a lot of fat and it kind of closes up that airway. So please make sure when you see your doctor, you discuss sleep apnea. Just say, hey, could you check that? Do I have sleep apnea, for example? The other thing that you can do is ask your dentist, because we can actually make an appliance that slightly moves your jaw in a position that we are able to allow you to breathe properly. So therefore, I did want to talk about sleep apnea a little bit here because it's so important for immunity, but that's a whole conversation that we can have at another talk. So it's very important to get good quality sleep, a good 6 to 8 hours of sleep, and the quality of sleep has to be good so that you're really, really resting. Now, this is my favorite topic. My favorite topic is called hidden sugars. because it's hidden, and a lot of people just don't know how bad it is, and the fact that hidden sugars are everywhere. So a lot of people are eating highly processed food, and highly processed food is basically a lot of the stuff that comes in a package. Any box of cereal or anything that you're kind of holding and that has a bunch of ingredients in there that you can't read. Like, if, for example, if it's got something like dextrose in there, that's not a normal word. It's not like apple or kale or an orange. Anything that sounds different is usually, that word means that it's a chemical base, it's a non-natural form. So rule of thumb is, if you're looking at something on a package and you don't recognize the words, is it's probably not good for you. You want to be looking at words that you recognize. And anything that has an O's in it, or anything that just sounds complicated, or E numbers, flavorings, all of those are unnatural. But for dental health, hidden sugars are very, very dangerous. They're dangerous for you generally, because hidden sugars can lead to diabetes and other health issues. But if you have a lot of the sugars in your diet, you're going to get increase of bacteria in your mouth, which is unhealthy for your system, and also a high risk of getting tooth decay. So if you can see on this slide, we've got over 90 different names for tooth decay. And that's really bad, because I'm sure that most of you didn't realize that all of these things, if you kind of look through there, you've got glucose, fruit juice, for example, you're not going to know that that's bad for you, because you're going to be like, oh, fruit juice. But fruit juice is another way of saying sugar. And if you kind of look down there, even coconut sugar, syrup, all of these things are just really, really bad for you. So you have to be making sure you're looking at a label and you are seeing if it has any of these things in there. So here's a little guessing game for all of you. I would like you to guess how much sugar is in an average can of your favorite drink. So I don't know if we're interactive here. If you can, Simran, can you hear me?
Yes, my dear, I can. And I'm like trying to guess. Is it 2, 6, or 10 teaspoons?
Simran, what do you think it is?
How much sugar?
Yeah.
I'm really scared, but maybe 6 teaspoons.
6 teaspoons. Okay. So you're going for the 6?
No, I go in for 10. You don't seem
Oh,
really
you're going
convinced.
for 10. All right. It is actually 10 teaspoons. So let's talk about, how would we know if, how can we read a label to see that? So most of us have been drinking a lot of these sodas for many, many years. And a lot of us, wouldn't you agree, Simran? I mean, did you know that it was 10 teaspoons of sugar in that can?
No, I had absolutely no idea. In fact, oh my God, I just can't believe this. No, I had absolutely no idea.
Okay, so would you like to know how you would be able to identify that in your foods?
Yes, please. It'll be of great help to all of us across the world.
Perfect. So every food packaging has a label on it. So can you see that it says on the side here, nutritional facts, and I've circled, it says 1 can. So 1 can will tell you how many sugars it has. So here it says total sugars is 39 grams. Now, the thing is, most people don't know what 39 grams means, because we just don't think in metrics and amounts. So what you do is, whatever that number is where it says total sugars, you divide it by 4. And then that will tell you the amount of teaspoons that you're having. So if you're looking at it, it's 9.75. So I rounded it up to 10 teaspoons of sugar that you are having in 1 can of Coke. Now, there's something else I want to share with you. Sometimes if you have a bottle of Coke or something and it says serving size, it might say 2 servings. So basically what it's telling you is that 1 can, or that 1 bottle actually has 2 servings. So then you have to times this by 2, because there's actually 2 servings in one of those containers. So that's another trick that a lot of the food industry, which is a $1 trillion industry, sugar is, that doesn't tell you that there is so much sugar in there, because they kind of hide it in serving size, number 1, and they hide it in grams because you don't know what it is. There's something else I want to point out in this nutritional label. Look at the ingredients here: carbonated water. So carbonated water has a lot of acid in there, and acid eats away your teeth. So if you're having drinks that have a lot of acid in there, what's going to happen is that acid is actually going to eat the teeth and cause holes and cavities. And then this cavity gets close to the nerve and then actually goes into the nerve. And then you get major infections in the body. The other ingredients in there is called high fructose corn syrup. High fructose corn syrup is something that's very damaging to you. Caramel color, phosphoric acid. I mean, who wants to be drinking acid? Natural flavors, which I don't know where the natural flavors are, but probably not. And caffeine. Caffeine's also is a stimulant there. So, bet you guys didn't know about that, right? So that's the end of my presentation, and I do want to ask, have you guys ask me any questions, because I'm very passionate about this. You can find me on my website, yourcaringdentist.com, and I'm on the usual channels, Facebook and Instagram. And I'm also part of the #Kind20 movement, where we are going to be hosting a YouTube channel soon, where we're going to be talking about health and wellness and getting people healthy and happy. So let's get back to us on Zoom.
Thank you.
Now that I know you use it.
Yeah. Thank you for your charming smile. And so now I'm going to tell this to everyone. If you want the bright smile like Dr. Sheila Dobee, then we have to follow all this. And we have a question for you, Dr. Sheila. And this comes from Rima Sharma. She says, can you please speak again on sleep apnea?
Okay, yes, sleep apnea is very prevalent in the society. So sleep apnea is when you're not getting adequate sleep while you're actually resting. So what happens is you're sleeping, you're fast asleep, and during that time you will actually stop breathing for a couple, like it could be maybe even up to 20 times in the night. So then you're not getting enough oxygen. And the way that you can tell if you do have sleep apnea is if you can hear someone snoring, or if you're snoring very loudly also. The other thing is if you have a pretty much thick neck, if you're waking up and you just feel very tired and not rested enough. Sometimes it could be a dry mouth that you wake up with, and headaches. So if you do suspect sleep apnea, the best thing to do is you can get a sleep study test done. And you go to your dentist, or not. There's some dentists don't do sleep apnea, but so for example, in my office we do sleep apnea, and we can actually send the patient home with a sleep study. And what they do is it's a simple thing. You put it on your finger, and it's measuring the amount of oxygen and how often you're actually waking up in the night. And if you're waking up more than a certain amount of times, then you have sleep apnea. And it's very important to treat sleep apnea, because not only is it bad for your health, increased risk of heart attacks, strokes, but it's also really because when you're sleeping, your immune system is kind of repairing itself. So you really need it for making sure that your immune system is working healthy. Now, if you go to the doctor and they do determine you have sleep apnea, it's not a big deal. It's a very easy thing to do. They can actually make a device where you kind of put it right near your nose, and then it gives you the right amount of oxygen, kind of feeding oxygen into your body, so that you are getting the right amount of oxygen. The other thing is the dentist can actually make an appliance that kind of moves your jaw in a position so that it opens up your airway, so that you are able to get the right amount of oxygen that way.
Thank you so much. Dr. Sheila, I have a question. I was most of the time hiding my face throughout, because I was like, oh yes, I'm not aware of most of the things that I learned right now from you. And actually, it's been an eye-opener for all of us. And we're talking of wellness, we're talking of immunity, which is of great essence at this point of time across the world. So I'm going to take this opportunity of thanking you as well. And you've spoken of all the great foods that we can have. You also spoke of the fruit juices. Is it still fine to not have canned juices and to have fresh juices, or even the fresh juices, since they have glucose, we should try and avoid them?
So if you're going to do juicing, the problem that with juices is it strips all the healthy fibers away. So fiber is really important. It's good for the teeth. It's good for your body generally. And if you're taking, if you're juicing, you're stripping the good nutrients from the fruits. So I would always say try and eat more of your fruits and juice. If you're going to juice, for example, just juice a little bit. Because if you're having oranges, for example, oranges taste great, but you're having 10 oranges in orange juice, that's a huge amount of sugar. So be mindful with how much you're juicing. The other thing that you can do is make a smoothie. If you're going to make a smoothie, I always say smoothies should be about 75% vegetables and the rest of it can be fruit. But when you do juice, you do take away the healthy fibers and you don't want to be having too much of it because, yes, that is a lot of the extra, that's a lot of extra sugar that you're having.
Sure. Thank you so much. So we're going to have less of sugar, but have a sugary smile, just like Dr. Sheila. And you have a really bright smile, Dr. Sheila. And to become like her and to have a bright smile like hers, we're going to follow you. Everything that you've mentioned to us is that we have great wellness within ourselves. We become really good with our oral hygiene as well, as far as, everything that you've spoken, not to have much sugars and how to take care of our hygiene, as well as, of course, if you want to look bright as well, because you're going to be in great shape as well. So I'm going to tell you, Sheila, Dr. Sheila, thank you so much for the
Thank
lovely
you.
guidance that you've given us, and it's been absolutely wonderful as always to have you here, and you're looking so lovely in pink.
Thank you so much for having me. I think it's such a great thing that you're doing, Simran and Neil, and doing this wonderful thing for the community. And I think this is exactly what we need around now. This is a great time to get healthy and work on our mental health and our general body so that we can stay healthy during this pandemic.
Thank you so much. And we're truly thankful to Dr. Sheila. And towards the end, as I said, that though we won't intake sugar, but we surely need that sugary kindness and sugary smile. Thank you once again. And, with a namaste, I want to thank our lovely Dr. Sheila Dobee. Thank you so much, sweetheart.
Thank you.